And I think what's been drilled in us too long is that if I have this pain or if I'm unstable, then I can't do too much because I'm already unstable. So I need to be careful of what I do. And we create this fear of moving more, this fear of doing too much, because again, the thought is like, if I'm hearing this clicking, clunking, especially when it's associated with pain, I'm doing damage. So I don't want to do anything more to create damage. And that's complete opposite of what we need to be doing in order to get back out of pain, create more resiliency, create more stability within that pelvis. We have to be loading the system appropriately so that we get to a point of not having symptoms anymore. Yeah. Right? And if you are hypermobile, like especially if you're hypermobile when into pregnancy and postpartum, you might still be dealing with symptoms, right? So that's why it's even more essential and key. We really get back to progressively overloading your body in a safe and effective way, but we cannot just keep you at the basics of doing some really simple exercises or just relying on an SI belt to create that external type of stability. Welcome back to another episode from the Optimal Body Podcast. I'm Doc Jen.
And I'm Dr. Tom.
Both doctors of physical therapy, coming to you about SI joint clicking, popping, clunking, especially if you're pregnant or postpartum and you're like, when is this ever going to end? Let's talk about it. Now, I personally experienced this a lot in my second pregnancy and postpartum. So I'm going to talk about that journey a little bit. But this it extends beyond just pregnancy, postpartum. So this is mostly those who are hypermobile as well and probably have experienced a lot of clicking and popping. We want to just help to understand where that's coming from. Do you need to do anything about it? And of course, if there's other things you're curious or you've been told about your body, like please drop it in the comments. This is how we know what kind of episodes you're looking for and wanting to learn. And if you want just, videos on SI pain or any other kind of pain, mobility flows, strengthening, we have all of that on the channel. So don't forget to hit subscribe.
Okay, so today we are talking about the SI joint, but specifically when it clicks and pops and clunks around. And I know you kind of wanted to do this episode because this is something you experienced a lot when you were pregnant with little Luca. And postpartum. And I got a question about this. Like, I'm still postpartum. I'm still dealing with SI clunking. Like, what does that mean? Why is this happening? So that's why I wanted to really do this episode to know that you're not alone. Now, specifically, we do have another episode on SI pain. We've done a few of them, actually. I feel like on SI, like, why are my hips out of place? Or why is why is my hips rotated? And is that related to SI pain and all the other things? So we have other episodes if you want to listen to those. This is really going to be more about like the noises that we hear. And it's not just pregnancy, postpartum. I also want to say that, especially hypermobile people can be hearing a lot of noises. Totally. And when we talk about the SI joint in general, so for those that might not be familiar, the sacrum is kind of the bottom of our spine. It's this grouping of essentially fused vertebrae that is at the very bottom of the spine. And then on the sides of that, we have our ilium bones on either side, which is a part of that big iliac crest, which is like the hip bone you can feel on the side when you put your hands on your hips. You're setting your hands on your ilium. So where those come in and meet the sacrum, that's the SI joint, SIJ. And the thing that's unique about this, our pelvis was built to be a very, very stable structure. It essentially houses our species' ability to reproduce. And so that's why it needs to be such a safe and stable structure. And because of that, the SI joint hardly moves. It has this motion that's called nutation and counter nutation, which is kind of like it rotating back and forth on each other. But even me doing this is like 100 more times the actual movement that you get at your SI joint. It's, it says from 1 to 6 degrees of rotation. And that's anywhere from 0.1 to 2 millimeters, not centimeters. 2 centimeters is not even an inch, 2 millimeters, which is a tiny, tiny amount of movement.
Yeah. And again, we've done episodes on this. Like, can a clinician really feel that movement? It's like,
with their hands, can they feel, oh, this side's moving more or this side's moving less when it's 0.1 to 2 millimeters?
Yeah.
Hard to say.
Hard to say. And it also changes between what a clinician is saying that they're feeling from clinician to clinician. So we just don't have good, strong evidence that you can really feel this movement, but that doesn't take away from what you are feeling internally. Like if you are feeling a lot of movement, that's what we want to address, right? We want to address you feeling unstable, that you're hearing a lot of noises, you're hearing a lot of clicking and clunking, and first of all, are you having pain? That's when we really want to be, okay, let's do something about this, and more so for the pain, not so much for the clicking and clunking.
Yeah.
Now, when you're having that, you have to understand as well, we have a lot of synovial joint along all of our joints, right? A lot of synovial fluid, I should say. And when we have this increased movement, whether it's from a hormonal shift from pregnancy or postpartum, or reduced laxity within our connective tissues from something like hypermobility or being on the spectrum of EDS, then we can have a little bit more movement than normal than someone who doesn't have or isn't in these phases of hormonal changes. And with that, hear a little bit more movement or clicking and clunking or just movement from those connective tissues. Because if we look at the pelvis as well, and we'll try to put an image on YouTube, there are so many ligaments that are connecting all over to make this such a stable structure that Dom was talking about. And on top of that, then you have all these tendons from these muscles that are connecting onto it. So there's so much connective tissue that's all over this iliosacral joint. With that, we can have a lot of different types of clicking and popping and movements along some of the bones.
And what I want to assure people, and you hear people say this, like they'll be getting up and they'll have a clunk or a click and say something like, oh, my SI joint just went out.
Yeah.
My SI joint just popped out. Although, like, I don't know if that's something that you were told, or that when you hear that popping or clicking, your SI joint goes out, or if you have a provider who says, yep, your SI joint's out or you're out of alignment, and that when it clicks, you're popping back out. Like, again, 2 millimeters of movement. 2 millimeters of movement. So the SI joint isn't just suddenly like shifting out of place.
No.
Again, like Jen said, with all those ligaments, all the structural integrity of the pelvis, it takes a car crash to have enough force to actually cause that joint to be displaced at all. And that is still rare.
Right.
It's still very minute movements that are causing these noises.
And it's not harmful. If you're hearing the clicking and clunking, it's not harmful to your system.
Maybe painful if you're feeling pain.
Maybe painful, yes. But not harmful. It's not creating damage. And so that's what we just really want to highlight. It's like, don't be afraid of it, but let's understand it a little bit more. Like, why might it be happening? And for a lot of reasons, especially if we're talking about postpartum and pregnancy, we're talking about that relaxin hormone, which sticks around after pregnancy. I can't even remember personally when my clicking and clunking kind of went away. I started to kind of just like be like, okay, this is my life. This is what I live with. I mean, Dom would hear it.
Yeah, getting up off the floor or something, and you'd hear the, like, just like a loud clunks.
Or remember when I was pregnant, I mean,
you were doing 90-90s.
Yes.
And it was like,
as I was shifting back to the other side.
Yeah.
Yeah.
So I feel like I probably heard you stop mentioning it or stopped hearing it maybe after you started getting back into strength training.
Yeah, I would say it was around 10 to 12 weeks when I probably didn't notice it as much. When I noticed it a lot postpartum is when I would shift in bed mainly. So again, I'm in bed, I'm relaxed.
Pushing off one side.
I'm usually on the side of my body, and I'm getting up so that I could breastfeed at the pillow that I put on the back of my bed. And so it was that transitioning from either my side to getting up, and I would just hear just so much movement. I'd be like, oh my gosh. And sometimes I would try to be like really conscious of, okay, let me do a deep exhale, gather my pelvic floor and my core, and try to like create some stability as I moved. But I also was in the middle of the night, and sometimes I was like, you know what, whatever. Again, it's not doing any damage. I'm not feeling any pain with it. It's fine. Like, it'll eventually go away. It's due to all these hormonal shifts and the fact that I just gave birth. So it was something that I also wasn't afraid of. And I think that's important to know as well, is like, when you continue to tell yourself, this isn't bad, this isn't scary, and I'm going to continue to work on things outside of when I feel this, well, then I know that it's fine. And so playing that mental game with yourself is so incredibly important. And it did eventually go away from some of the exercises we're going to talk about.
Yeah. And just when it comes to SI joint pain related statistics, so this is kind of classified or categorized in low back pain because it is like at the bottom of the back. And when people talk about it, they talk about it as a back pain more than a hip pain or pelvic pain or anything like that. And so when it comes to low back pains, about 15 to 30%, depending on what research study you're probably taking this from, between 15 and 30% of back pain cases can be categorized as SI joint pain. During pregnancy, nearly 50% of people will report significant pelvic or low back pain, which often include or involve SI joint issues. And postpartum, 20% of people still have SI-related pain 2 to 3 years later. This is a very pervasive issue, especially for the pregnant and postpartum population.
And I think what's been drilled in us too long is that if I have this pain or if I'm unstable, then I can't do too much because I'm already unstable. So I need to be careful of what I do. And we create this fear of moving more, this fear of doing too much, because again, the thought is like, if I'm hearing this clicking, clunking, especially when it's associated with pain, I'm doing damage. So I don't want to do anything more to create damage. And that's complete opposite of what we need to be doing in order to get back out of pain, create more resiliency, create more stability within that pelvis. We have to be loading the system appropriately so that we get to a point of not having symptoms anymore. Yeah. Right. And if you are hypermobile, like especially if you're hypermobile when into pregnancy and postpartum, you might still be dealing with symptoms, right? So that's why it's even more essential and key. We really get back to progressively overloading your body in a safe and effective way, but we cannot just keep you at the basics of doing some really simple exercises or just relying on an SI belt to create that external type of stability.
So there's this one study that I found kind of funny because there was 500 pregnant women that they looked at in this study. And when expert therapeutic advice was given, it led to significantly better pain and disability reduction versus when no advice was given.
Yes. But that's significant to bring up because a lot of women, especially pregnant, will go to their OB and say, "Oh, I'm having this pain." And the OB says, "That's normal. You're pregnant. Just have birth or
just have the baby.
Just have the baby. Once you have the baby, then you're not going to have pain anymore," which is 0% helpful.
And maybe not be true because you might still have the pain for months after. So yeah, it's good to get exercise recommendations when you're in pain, especially during pregnancy. And this is where the whole mentality of like, okay, if you are going to plan on becoming pregnant or conceiving, you should start early. You should start months leading up to pregnancy, preparing the body for what it's about to go through. Because the second part of this study said that early intervention, which they labeled as second trimester, rather than I'm sure starting in third trimester. But like,
well, as soon as you start feeling symptoms.
As soon as you start feeling symptoms, so early intervention with exercise advice and recommendations was better than late. So get advice, get it early, I guess is the message there.
Now, another thing that I think is important to bring up is talking about wearing that SI joint belt, because that's something that is recommended for a lot of women and it's not bad. Like if you feel that you have a symptom reduction when you're wearing an SI belt, or if you feel a little bit more stable when you're wearing it, I think it could be a great tool to utilize alongside exercises. So we don't have super strong evidence that an SI joint belt alone is going to help to reduce pain. But what we do see that it could be a tool alongside exercise. What we also know is that exercise, like the specific type of exercises, what is the specific exercise protocol that's going to get rid of my SI joint pain? We unfortunately don't have one good protocol. We don't have like, here's the set of exercises everyone should be doing. We don't even have good research saying that you should only be doing core stability exercises and that's going to help reduce your SI joint pain. But what we do know from overall research and looking at like strong evidence is that exercise, general exercise, movement of some type is better than not exercising. right? And so this is where it becomes so beneficial. And can we say, sure, there's help in getting mobilization or manipulation when you have hands-on treatment that can help to reduce pain symptoms, but it's always short-term. We're looking at those as very short-term outcomes when we're reducing some of those pain symptoms. So when we're looking more long-term, when we're looking to be able to bend down and pick up your baby and hold your baby and not have any pain, or if we're not talking about pregnancy, postpartum, just live your life, right? Then we have to be adding in exercise, and we have to be progressively overloading the system in order to gain strength and resilience.
And I thought it was interesting because you found this article or this study that talked about how a lot of people talk about core strengthening or core training, or specifically activating the transverse abdominis, which is our deep corset muscle. And people, the thought is, if we have more stability in that corset muscle, it'll help the low back, SI joint feel safer and help reduce our pain. And they found that the transverse abdominis was more active in people who had overactive in people who had SI joint pain, which kind of makes sense to us. Yeah. If they're having that pain, they're probably bracing, and they're probably doing so constantly because their body is scared. Their body wants to find more stability. But in doing that, having an overactive transverse abdominis doesn't mean it's strong and functional.
Mm-hmm. Exactly.
It means it's overactive. And in our minds, that tells us, that is dysfunctional because it's probably just bracing and it's probably not working dynamically. So that's why in the what to do part of this podcast, one of the first things that we talk about is learning to coordinate your breath, rib cage expansion, relaxation of your diaphragm and pelvic floor with contractions of your diaphragm, pelvic floor, and transverse abdominis.
And you literally could do this so easily by just breathing and focusing on more of a lateral expansion of that rib cage. Because when I get, if I put my hands around my low rib cage and I get my breath to expand laterally into my hands, I'm going to get my diaphragm to naturally start to, move more lower when I'm breathing in. And if I can get that lowering, I automatically put more pressure into my abdominal system, which is going to put pressure down into my pelvic floor. So without even trying, I'm creating a little bit more length into my abdominal, my back region, my pelvic floor region. And then when I exhale and I focus on a really targeted exhale, drawing from that pelvic floor up, drawing those ribs down and together, I naturally start to contract without having to overdo anything, right? Without having to do the perfect core contraction, the perfect pelvic floor contraction, but I'm just focusing on rib cage movement and deep coordinated breath, well, then I can already automatically start to work on these things. And especially doing a deep exhale with pursed lips, you're putting a little bit more resistance through the breath, which helps to add resistance into the core, into that abdominal system. And so now I'm going to be adding load without even trying to do anything heavy, right? But I'm adding a little bit more load to my system. So just working on that alone can be a huge tool. Do 5 concentrated slow breaths every single day, focusing on pursed-lipped exhaling and really maximally exhaling out as much breath as you can as you feel that rib cage move along your hands. That alone is going to help to start to get that pelvic floor and start to increase stabilization through the pelvis and start to feel a little bit more supported, whether you're pregnant, hypermobile, or postpartum.
And the slow pursed lip breath helps with, along with the resistance that you kind of put behind the breath, it helps with the control of the contraction of that pelvic floor and diaphragm. And then kind of the overactive situation that we were talking about earlier, that's where you start to build back into your motor pattern for breathing and pelvic floor contraction, the control through the whole length of both of those muscles. And so that's super important. And this is just the baseline where we would start. This is day 1, doing a couple of these things before you move on to phase 2. This is also the phase where you might think about trying one of those pelvic belts and see if that feels like it helps alleviate symptoms. If not, probably not for you, probably not something you're going to, you might not need it. And then we move into phase 2, which is doing more dynamic movement.
Yeah. So starting to get that coordination with movement now. So now I'm getting that breath kind of coordinated together. So how do I coordinate that with movement? So I'm using that breath and then doing a bridge hold or doing repetitions of a bridge. I'm doing that breath and then doing a clam shell. Like you will notice once you start to coordinate that breath and pelvic floor, and you should still, like if I do a long deep exhale and I hold that contraction, now I'm holding my core contraction, my pelvic floor contraction, my ribs are kind of down. I can still breathe holding that contraction from the sides of my rib cage. So I could still take breaths from that sides of my rib cage without losing everything. And so that's what you kind of start to implement into exercise. Now I could do that with a bridge. I could do that with a clamshell. I could do that with a bird dog. So I could start to do that with different types of exercises. So I'm re-coordinating and repatterning, starting to turn off things like only using my hip flexor, only using my low back, and we're starting to really build in that stabilization.
And that'll seem kind of contrary to some people. Like, how do I hold the contraction and then still breathe? And that coordination if that coordination is difficult for you, that's really something to nail down on and work on, because that is what's going to be the next step of building that dynamic support throughout the whole core, from diaphragm, pelvic floor, and transverse abdominis during some of those other exercises you said. And then phase 3, after you get used to some of those exercises, is working into building up that load and doing more, I would say, single leg stuff, so that you're building stability in resisting rotation, in resisting that pelvic motion that might be causing the clunks or resulting in the clunks in your SI joint.
And just building more resilience. Like every step we take, we have single leg control. We have single leg balance every step that we take. So if we're feeling really unstable every step we take, well, then the answer is to increase stability in a single leg position. If we're always doing things double legged, then when we're doing squats, when we're doing deadlifts, like we're not getting into that split stance and doing something a little bit different in lunges or Bulgarian split squat. Am I doing things where I'm starting to even just do a kickstand? So you have one foot in front and the other foot just kind of kicked behind as support, but not doing a lot. Then I'm still working that stabilizing leg as I'm a supported RDL or a supported squat. So I'm still building up more of that single leg stability while still, having a little bit of support rather than just jumping into like a single leg RDL or a single leg squat or a single leg sit to stand. So a lot of these are so incredibly important, but we can't then neglect, that's where I feel like Copenhagen planks play a huge role in starting to create that stability. Doing things where even if you're doing bridges, you're starting to do it with squeezing a ball or a pillow between your legs when you're starting the bridges. Again, bringing in a lot of that increased muscle awareness and activation so that we're utilizing more of our system to create a little bit more overload of those muscles and create more tension. And the last thing I will say is that we have to create more mobility around the area as well. If we want things to get strong and move well, they need to move through a full range of motion. So if we're neglecting hip mobility, if we're neglecting upper back mobility, we can be putting a lot of unnecessary pressure into that SI region. And so getting above and below those areas really mobile and moving better, well, then we're going to feel better when we're doing more exercises in general and moving throughout our day.
And if you're looking for a program to follow and a community to be able to do that with, come join our 30 Days of Release and Recovery course. It is incredible because it hits on a lot of what we're talking about. It
everything we're talking about.
Pelvic floor movement, stability. There's pelvic floor exercises every week. There are rib cage exercises every week. There's mobility. There's breath work. And then there are also some days where you get to use tools like foam rollers and balls to help roll out areas of tension. So really just meant to down-regulate the system. As our podcast listener, you can get a bonus discount using code OPTIMAL10 on that course. So you can check that out down in the show notes. That's jen.health/grateful. Come join us. It's a great thing to follow, especially if you're just looking for something that's not going to take too long each day and get you into your body, get you into your feels a little bit and down-regulate that system. Thanks for joining us for another episode all about that SI joint clunking and clicking. Did you learn anything? Have you experienced this before and found a solution that worked well for you? Please comment below, let us know, and also let us know if there are other topics related or unrelated to this that you would want us to do episodes on. We look for that feedback from you so we know what content to create. Make sure to hit the subscription button and notification bell before you take off, and we'll see you next time.